Today is Wednesday, May 15th. It's hard to believe. We're already in May, Rebecca. It seems like it was just January.
Yeah.
And we're here to keep all of you, our guests, our patients, our friends at Hillsdale Hospital, our neighbors, informed of what's happening in Hillsdale and other counties, and to those that we serve in our communities. I'm your host, JJ Hodshire, President and Chief Executive Officer, minus Rachel, who historically has been with me, our Chief Communications Officer. But unfortunately, she's out today. She's actually in Lansing, lobbying, doing some work for us there. But I am joined in the studio by a fantastic friend of Hillsdale Hospital, a good friend of mine, someone who has been with us here during some of the most difficult times in our hospital's history and our community's history. And it is my pleasure to introduce back in the studio again, for live. We no longer call it Facebook Live because we're broadcasting this across every social media.
I love that.
It's great to have Rebecca Burns. She's the health officer for our, we'll share a little bit about the three communities that you serve, the three counties. But I'd love for a great Hillsdale welcome to you, but I'd love for you to share a little bit about yourself, and for our listeners who don't know, what is the job that you do? What's the health department? Can you give us that first?
Sure. Well, so Branch Hillsdale St. Joseph Community Health Agency, we're a local public health department, which throughout the state of Michigan, every community has a local public health department. I'm the health officer, which means that in this particular case, I'm an administrative health officer. So the business side of public health. And we have a medical director that does the medical side.
Dr. Luparello,
Yes,
for those of you who know her. Lots of folks here in the county know her.
And we are thrilled to have her, lucky to have her. So that's what we are and what we do. And
locations all over. We'll talk a little about that in just a minute, but serving a wide variety of customers, community members, with a lot of topics that I want to jump into here today. There's a lot of things on the front of mind that are happening in our communities that are very concerning and that are important for our community to know about public health. So with that in mind, why don't you talk to us a little bit about what is, top of mind right now? What are you working on, and what should we as community members be thinking about May 15th on?
Right. So there are a number of items that are currently hot topics in public health. So one of those is cases of measles that have been found both in Michigan and in some of the states around us, and making sure that individuals are protected against that. We also are paying great attention to highly pathogenic avian influenza, which is being brought with migratory wild birds into our communities as they migrate, and infecting commercial poultry, backyard flax, and now also being found in dairy cattle. And so
confirmed in our area?
Confirmed, not in our area.
Okay, good.
Our 3-county area does not have any confirmed.
Okay.
So,
but in Michigan, there are some confirmed?
And absolutely in Michigan, especially in central West Michigan, are some cases of dairy and poultry. So paying a lot of attention to that and messaging on that topic. We're also, as the weather gets nicer and it warms up, talking about we're talking about ticks and mosquito safety and what individuals need to do to protect themselves from those types of diseases, how to care for your skin, and food safety if you're out with family, water safety. And then finally, we've been just recently talking about storm safety because of the tornadoes that made it their way through St. Joseph and Branch County, and caused quite a bit of devastation to families that were in the path of that.
And I know that Sherwood, your community over in one of your counties, home that was just blown up and destroyed, maybe several that were totally destroyed. Time of year for us to give pause and consideration to making sure that our affairs are in order as it relates to prepping for storms. And that's, you have a whole program. I know that Chris Dewey in the past has done some lectures on this, and certainly it's the front of our mind and should be as we prepare ourselves for the inclement weather. Now, there's a couple of things. Let's talk a little bit about the ticks, because I had a council member approach me asking if I know why the seems to be an increase in the ticks this year. Any insight into that?
It was a really warm winter. And because we didn't have a lot of cold weather, hard frost that really helped to minimize or die down that population, and the early spring has caused an increase in tick activity. Ticks are always here,
right?
But the conditions are just ideal right now. It's they like wet, moist conditions. These types of temperatures, and until it gets really hot and dry, we're going to continue to see ticks.
And mosquitoes are prevalent, and they're out and about. We have to be careful with that as well.
Yes,
that's important. So as they're outside, as our community members are outside, just bear in mind that those little creatures can wreak some serious havoc, because ticks, Lyme disease, a lot of things that can really result in some very bad health outcomes.
There's a lot of tick-borne, mosquito-borne diseases that if you're outside in the evening at dusk and dawn, you need to take precautions to prevent those mosquito bites, long sleeves, insect repellent. With ticks, stay out of long grass. And protect your animals the same way, so that they're not bringing them in.
All right. So a lot of conversation right now across all media channels about measles. And it's concerning, obviously, for health officers. And I guess let's talk a little bit about what our listeners should know about measles vaccination, and talk a little bit about what that should encompass. And I guess there's always risk, there's always signs, there's always symptoms. Talk a little bit about that as well.
Okay. So first off, we want people to know their status. So if you have no idea if you've ever received a measles vaccine, you can check your record either at your provider's office. You can check it on your own at the state MICR site. You can stop into our office and ask our staff to check your status. We would be happy to look that up for you and let you know whether you've received the vaccine or not. The other thing about the vaccine is that it's called MMR vaccine, so measles, mumps, rubella, and that vaccine has been around since the 1960s. It has been researched. It has been shown over and over and over again to be safe and effective. So this is a vaccine that is not new, and we should not be concerned about the safety of that vaccine. We are concerned about measles now because people that travel to other areas where measles is common and bring it back, we've got a lot of unvaccinated people. And so if you have a case that comes into your community, the folks that are unvaccinated are 9 out of 10 times likely to develop measles if they've been exposed.
Oh my.
So it's very contagious. And it can cause serious health complications, especially in children under 5. So we look for symptoms and signs that include high fever that may spike to more than 104, cough and runny nose, red watery eyes, and a rash that will begin 3 to 5 days after first symptoms. And the other thing about measles to know is that folks that have been exposed and are shedding that virus, they shed it before they know they have it. So it's really important to take steps to prevent the infection in the first place. And that is that MMR vaccine.
And let's just be honest, because we've tackled some tough issues here. COVID has brought about a lot of arguments, and there's 2 different camps about vaccines, and then those that believe that there shouldn't be people that receive vaccines. And I think since COVID and the elevation of vaccination, we have witnessed a decrease in vaccinations beyond just COVID, and that is quite concerning.
That you're absolutely right. So our vaccination rate in our area and in the state of Michigan has been dropping, and that's nationwide as well. So as more and more people are unvaccinated, then that allows for more opportunities for a disease to come into our community and then spread.
Correct.
If people are up to date on the vaccines that are recommended, then we have less opportunities for that.
Yeah.
And always remember, there are people that can't get vaccines.
That's true.
Not just from choice, but because they have a medical reason
health reasons
that keeps them from getting vaccinated.
Yeah.
So, when those of us that can get the vaccine, get it, we're helping to protect those individuals in our community who have no other option.
Yeah.
So
absolutely. Just be cognizant of the fact that I think the measles vaccine you said has been around since 1960.
It's been, the 60s, absolutely.
The 1960s. And so it's nothing new.
It's not new.
And we know how to spread, how to stop the spread of some of these things. So it's very important to give pause and consideration to your family and to your community members. All right. Summertime.
Summertime.
You've already established that. Can we sing that? Probably shouldn't sing it. But it's summertime. And with that, it's friends, it's family, it's backyard barbecues, it's church picnics, it's all that good stuff. Yeah. But part of your job is, you do regulate the food industry. Yeah. And you monitor it, and the health department goes into restaurants, but you also have a say in community gatherings where food is being served for the right reasons. It's not just you want to be there for the nice cookout. Yeah. It's because of the concern of obviously individuals getting sick.
Right.
Talk to us a little bit about what precautions we should take as we enter the season.
Yeah. Well, this is the best season of the year, right? Because we can get outside and enjoy our friends and family. If you're doing that over food, if folks come in, they everything gets laid out on the counter and it stays there for a little while. And that's okay, but we want to think about cold food staying cold, hot food staying hot. Yeah. And then if it's been out for 2 hours, not worth saving at that point. Yeah. Time to throw it away. And we do regulate the commercial food business.
Right.
And when it comes to just families and family gatherings, we're just trying to provide the best information.
Absolutely.
so
Not regulating.
So that people don't
get sick.
Yeah, we really don't want people to get sick. I mean, that's kind of our whole purpose is prevention.
Yeah, absolutely.
So yeah, and while you're enjoying those wonderful, yummy foods, remember if you're out in the sun to stay hydrated.
That's huge. It's huge.
Nobody wants to have to seek medical care because they were out in the sun all day long and didn't drink. And then also use sunscreen to prevent sunburn. So,
Rebecca, there's also, this time of year, bats are flying and getting in homes and rabies. You want to talk a little bit about rabies because let me tell you, I've heard individuals that have been either suspected of having been bit by a bat or who have been bit. And to go through those, that's pretty aggressive.
Yeah.
And so talk to us a little bit about prevention of that and what happens if.
Yeah. Well, if you have seen a bat in your house, there's an opening somewhere that's allowing that bat to get in. So that would be step number one, investigate where you live and look for any small little opening where a mouse or a bat can gain access and seal that up so that they can't get in. If bats do get in your house, if you happen to wake up and you see a bat flying around in your bedroom, that is a bat that you want to try and capture and bring to the health department and have a conversation with our nursing staff about, is this a bat that should go up for testing or not? Okay. They're going to be able to make that decision based on the information that individual provides.
Now, is it true you're not allowed to kill a bat? I've heard that before. It's not true, is it?
We have to kill a bat if we send it up for testing.
Thank you.
The lab would be disappointed
if we send a
live bat.
All right. We have to dispel that myth. All right.
Yeah, unfortunately, we have had to euthanize some bats that have been brought in.
Yeah. And some people think that they have to bring them in live, but
Well, what you don't want to do is damage the brain of the bat. If it's in your house and you're you want to be able to capture that bat without destroying destroying it because the brain is
bringing in the wing probably not gonna help.
We need the head
so
that we can test for rabies. So
All right. Well, obviously rabies comes beyond just a bat, but that's the
Right.
most frequent as they're flying around the houses. So,
Yes.
there are many experts out there who know how to check your house for openings, and that's something important if you notice bats around. Real quick, you have a campaign, Lock Up campaign. Talk a
Yeah.
little bit about what that is.
Our Lock It Up campaign
Yeah.
has to do with marijuana, and it is intended to just share with folks that we want to keep that product away from kids, and keep it locked up. So,
Yeah.
it's legal now in Michigan
Yeah.
to buy marijuana and use it. Before that, we had medical marijuana. So we are not saying that folks should not use the product.
Right.
We are simply saying that probably not best for kids to have access.
Yeah.
And so if you've got it, just keep it locked up and away from kiddos. That's it.
And some of the forms of marijuana are gummy bears or gummies, and so they can look for a child.
Yeah.
They could get their hands on that, and that's something that you just want to be very mindful of.
Yeah.
And locking up anything, grandma's prescription drugs, to alcohol, whatever it is, it's just being cautious. And this is one more step for that. So, Rebecca, I'm going to ask before we sign off here if there are any questions. No questions, but I want to commend you and your team. You have a remarkable team. You took us through one of the most difficult times of my careers, which was COVID-19. We partnered together. Yeah. We really provide a tremendous amount of education. You did as well. Long nights, early mornings, vaccination clinics throughout the Tri-County area. Yeah. You gathered up on the college campus with me many times as we processed thousands of people during the beginning of the rollout of vaccination. And so I just want to thank you for your commitment. That was one aspect of your job, though. You all do a tremendous job. You have physical locations in every county, correct?
We do. Yep.
And it's open to the public.
It's open to the public, 8 to 4, Monday through Friday.
What types of services can a citizen get there at those clinics?
So immunizations, STD, HIV testing, and treatment, and communicable disease control. So if somebody has a communicable disease, how to care for that and prevent further spread. Yeah. Oh my goodness. We have radon test kits available. Okay. We have all kinds of information and education documents on just every topic that you can think of.
If someone's seeking a vaccination, do they have to call in advance, or how do you like to have these set up?
We do prefer that people call first,
okay,
and make an appointment. But certainly, if you need to walk in and ask, please do. So we would rather people walk in and we try to take care of them right then if we can. But if they can call us and schedule, that is our preference.
Excellent. Yeah. Rebecca, you're doing a remarkable job. You and your team educating our community. You're a great resource to all of us in healthcare. And I just want to thank you for your partnership with healthcare in each of the respective counties. I can speak to Hillsdale's relationship with you and your team. It is phenomenal, and we work very closely together to push out information. Your medical director is well known in Hillsdale County. We have that advantage, but she's always pushing out information through Chris and others. Really, just what should physicians know about what's happening with measles? Right. That education is so critical to our operation here. For the public and we'll close with this, for the public member that just wants to know a little bit more about the health department, you have website, Facebook. What do you have that, their training videos? What do you have?
Yep. So our website is bhsj.org. We have a Facebook page, Instagram account. We have a YouTube channel as well, which has educational videos as well as public meetings are on there. So those are all ways for people to get information. Great.
So please check it out if you get a chance, and thank a public health worker if you get a chance. They have a thankless job. And we would just encourage you to give your thoughts and your care and your kind words to the health department. Post something on their Facebook. They do a tremendous amount of work in education in our schools, with our education community, as well as with your healthcare community. So thank you for joining us today. It's been great to have you here. For our listener, thank you. You are why we are here. your utilization of our services, understanding the importance of rural health. And you can get your healthcare services anywhere in the state, in the tri-state area. But choosing to come to Hillsdale bolsters the economy locally, but also allows you to build a relationship with providers who care each and every day. They're servicing you, your family. You see them in your churches and in your community events. We're building relationships. When you come into the hallways of our hospital, we know you. We know you by name many times, and you build that relationship. And it's people who care who are rendering aid to you and your family. So we would encourage you to continue to utilize our services. That's what makes Hillsdale Hospital strong. When you choose us first. Also, you have other opportunities to nominate healthcare workers. You can do that. If there's a staff member that you know has been just phenomenal, whether it was an inpatient stay, maybe they took your blood and no one else is able to draw it on the first, and they do. That's something that you can nominate someone for and to thank them. You had an ER visit. You can nominate a family member, a friend, someone you know maybe is just doing a phenomenal job in healthcare by going to our website, hillsdalehospital.com, and then award. You can go and nominate someone. That's very important to pay recognition to our healthcare workers who are working day in and day out to take care of the most the sickest among us. Also, we have a fundraising campaign. We're raising $1 million. I'm pleased to report that as of today, through commitments, that's individuals who have pledged, and donations that we've received, we're close to halfway of our goal. And that's incredible. So up through December. So if you want to make a contribution, just this week, I went to the mailbox and in a plain envelope was a check for $10,000 from a community member. Again, never asked this person, never knew that they were willing to make the contribution, but they just mailed a check. That signifies the commitment that our community has for a hospital like ours. And our commitment back in return is that you'll receive the best care, the highest quality, lowest cost, and continuing to serve this community for another 107 years. Very, very important. We also would encourage you, if you're looking to join a award-winning healthcare agency, Hillsdale Hospital is the place. We've received many accolades throughout the state and the nation for the hospital that we run here and for the commitment we have to our employees, every one of them. So if you're looking to join a winning team, we have 51 open jobs right now, lots of them. You can go to our website again, and under the careers tab, you can apply for one of those jobs. These jobs can really just multiply into other opportunities here at Hillsdale Hospital. We've had many individuals that start in laundry that are now a nurse. Individuals that start as a CNA that are now taking classes to become a pharmacy tech. The list goes on and on of individuals who have been promoted here at our hospital that we invest in millions of dollars throughout the last several years to educate and train our workforce to ready them for healthcare. So if you're looking to join a winning team, please do that. You can catch us every week on WCSR. So on Friday, we have an opportunity to share information. Rebecca's going to be a guest of mine this Friday on WCSR. And then we're asking you, the community, to share our Facebook posts, to share information like this when we're live. Let this be known to the community of these resources that do exist. So we want you to also consider our podcast, Rural Health Rising. It's a national healthcare podcast. And I tell you, we have some phenomenal guests from Supreme Court justices to policymakers to experts in healthcare to congressional leaders. We would encourage you to listen to our podcast once a week. It comes out every Thursday morning. So wherever you get your podcasts, download Rural Health Rising, share with a friend. We'd love to be able to get this information out. And it's really about highlighting the importance of rural health in the country. There's been 140 closures of rural hospitals in America since 2010, and that number continues to climb. Just last Monday, there was an announcement that was made that a 31 hospitals in a system were going bankrupt, and the majority of those hospitals were going to close. This is what's happening all around us. But when you use us and you trust us with your healthcare, we can sustain what we have in our local community, the third largest employer, second largest in the city, third largest in the county, contributing back hundreds of thousands of dollars each year in community benefit through donations to food banks and to other charitable donations that we make. So please continue to use Hillsdale Hospital. We'll see you here again next Wednesday. And until then, stay safe, stay healthy, and stay Hillsdale strong. But please choose Hillsdale first. Thanks for joining us today.